everyone. My name is Rose, and I'm a sophomore at Smith College, majoring in statistical and data sciences.
I'm Clara. I'm also a sophomore at Smith College, majoring in the statistical and data sciences. And this is our project, Analysis of Sleep and Depression as Risk Factors for Diabetes. So this was a project that seemingly began 5,000 years ago at this point in February of 2020 as part of a multiple regression course taught by Professor Benjamin Capistrant. It spanned about 5 months, including the hectic shift to remote learning in March, and we're incredibly lucky to have had the support we did from the professor throughout the project. When we first started, we were interested in modeling something public health related and turned to one of the most common conditions in the US, diabetes. Over 34 million, or more than 1 in 10 Americans, are diagnosed with diabetes and face an overall 60% greater risk of early death compared to non-diabetics. This underlined the importance to us of determining what might put people at risk of developing the condition. In addition to well-known factors, like being overweight and having a family history of diabetes, we found some literature describing excessively short or long sleep as strongly associated with diabetes as traditional risk factors. We also found a meta-analysis reporting that individuals with depression are 37% more likely to be diagnosed with diabetes. When we considered this literature altogether, we realized there might be a connection. Sleep duration and rates of depression have been linked together in other studies, and now these reviews supported the idea that they are each independently linked to diabetes as well. This made us want to investigate, is there an interaction between sleep and depression as risk factors for diabetes?
In order to answer this question, we used data from the National Health Interview Survey from 2018. Our sample consisted of 35,000 randomly selected adults from the United States, and our sample was mostly white, about 80%, which limits the degree to which we can generalize our findings to minority groups. Our response variable was a binary variable, indicating whether or not each individual had diabetes. And our two primary explanatory variables were number of hours of sleep per night and depression frequency, categorized into 3 categories of daily or weekly, monthly, and rarely. And we also chose to control for several covariates, including age, BMI, sex, physical activity, income, and race. And for physical activity, in order to calculate an overall score that incorporated light, moderate, and vigorous physical activity, we used a formula from the Godin-Shepherd Time Leisure Exercise Questionnaire. We then fit 4 logistic regression models. All of them had the binary response variable of diabetes or no diabetes. And our first model was the most simple model, which only included sleep and depression frequency, as well as the interactions between the two. Our second model also included all of the covariates, so that was our full model. And our third and fourth models were very similar to the full model, except they were separated by sex, so there was one specifically for females and one specifically for males. All of the assumptions for the models were met, so it was reasonable to proceed with significance testing. In order to analyze the overall usefulness of each model, we performed likelihood ratio tests, and we also calculated the percentages of concordant pairs for each model, which is the percentage of model predictions that match observed values of the response variable in the data. And in order to analyze the significance of each individual explanatory variable accounting for the others, we performed the tests on the coefficients.
In our first model was just sleep duration and depression frequency as predictors, we found all coefficients to be significant and the percent of concordant pairs to be 53.6%. In our second model was sleep duration, depression frequency, and all covariates, we found only daily weekly depression to be significant and the percent of concordant pairs to be 85.6%. In our third model, with all variables, but examining only women, daily weekly depression was once again found to be significant, and the percent of concordant pairs was 85.7%. In our fourth model, examining only men, no variables of interest were found to be significant, while the percent of concordant pairs was 86.0%. As you can see, the full models explain the data much better than the simple model.
Here we can see visual representations of each of our 4 models. So we have number of hours of sleep on the x-axis and predicted probability of diabetes on the y-axis. And in red is individuals who experience depression often, and in blue is experiencing depression less than often, so monthly or rarely. Based on our most simple model with only sleep and depression frequency, which is the first figure, we can see a clear relationship between sleep and diabetes risk, although we were surprised that it was a positive relationship because previous research had suggested a negative relationship. And we can also see that individuals who experience depression often are at a much higher risk of diabetes, according to this simple model, than individuals who experience depression less often. However, once we account for the covariates, both of these relationships become less clear, and the relationship between sleep and diabetes becomes insignificant. However, the relationship between depression frequency and diabetes remains significant for all models except for the one using only males.
Here are the coefficients of interest for our full logistic model with both men and women. You can see that depth often, which represents daily weekly depression frequency, is the only significant coefficient. The likelihood ratio test has a very small p-value, indicating our model is more effective at predicting diabetes status than a null constant model. Looking back on our process a little bit, we were originally planning on using a linear regression model to analyze our data, but decided against it when we looked at the possible response variables. There were 2 response variables we could use to represent diabetes, including a binary indicating whether or not an individual had diabetes, and a numerical variable describing the length of time an individual had had diabetes. We decided to go with the binary variable because we reasoned the numerical variable was more representative of the individual's age than the severity of their diabetes.
Our analysis has several limitations. Firstly, we were unable to account for several covariates that may have been important, including nutrition, genetics, and other health conditions besides diabetes. Also, all of our values were from a survey, so there could be inaccuracy due to individual reporting, and there could also be a lack of precision due to rounding. Also, we modeled the relationship between sleep and diabetes risk as a linear relationship, and previous research suggests that there may be more of a curved relationship with both short and long sleep influencing diabetes risk more highly, so that could be something to account for in the future. Also, our analysis was correlational, so we cannot determine any cause and effect relationships due to the possibilities of reverse causality and confounding. However, our analysis also had several strengths. For example, our sample was very large and it was randomly selected, so it is representative of the non-institutionalized adult population of the United States. And our measures were all fairly reliable and comparable to other research in the field. For example, even though our values of sleep were self-reported, many studies involving sleep do use self-reported values because it is difficult to obtain direct measures of sleep. Overall, we concluded that experiencing depression often is a significant predictor of diabetes, especially for women.
And our findings support a link between mental and physical health, suggesting this would be a fruitful area for additional research. In closing, we'd also like to acknowledge that we originally began this project with Shirley Zhang, a junior at Smith College who was ultimately unable to continue after the shift to remote learning. Thank you.